Hello and welcome, especially to all you B-Pharm students out there. If you're diving into the world of pharmaceutics, you are in exactly the right place. In this explainer, we're going to break down monophasic liquid preparations for body cavities. Trust me, it's a super fundamental topic, and we're going to make it crystal clear for you.
Okay, so here's our game plan. First, we'll nail down what these liquids actually are. Then, we're going to zoom in on the specifics for ears, then the nose, and then formulations for rectal delivery. To wrap it all up, we'll boil it down to the absolute key principles you need to know as a future pharmacist. Let's get into it.
All right, first things first. Before we can even talk about ear drops or nasal sprays, we have to get on the same page about what a monophasic liquid actually is. Let's build that foundation.
So, what does that really mean in simple terms? Well, think about adding salt to water. You stir it, and the salt disappears, right? It's completely dissolved. You can't see the individual particles anymore. That's a monophasic solution. It's one single uniform liquid phase. The key words here are clear and homogeneous.
Okay, let's take that principle and see how it works in the real world. Our first stop is the ear. We're talking about ear drops, or, as you'll see them called, oral preparations. Now, as a future pharmacist, you need to know that ear drops are used for a whole range of things. Yeah, they soften earwax, but that's just the start. They are a critical way to deliver drugs to relieve pain, powerful antibiotics to knock out an infection, and even steroids to reduce inflammation right where it's needed.
Now this is where the pharmaceutics really gets interesting. We're talking about the vehicle, which is just the liquid base of the medicine. And for ear drops, we pretty much avoid water. Why? Well, think about the ear canal. It's got a waxy, oily secretions. And what do we know about oil and water? They don't mix. So to get the drug to work, we need a base like glycerol or propylene glycol that will actually mix with that waxy environment. That way, the medicine makes contact and does its job.
Let's make this even more concrete with a classic example. Chloramphenicol ear drops. You'll see these prescribed for bacterial infections in the ear.
And look at how straightforward this preparation is. It's a perfect example of what we're talking about. You take your drug, the chloramphenicol, and you dissolve it right into that oily vehicle, the propylene glycol. Then you just top it up to the final volume. Simple, effective, and it creates that clear monophasic solution we need.
Okay, let's switch gears completely. We're moving from the ear to the nasal cavity. Now, I really need you to lock in on this next part because the rules are totally different, and honestly, it's a huge patient safety issue.
This is a non-negotiable. You have to remember this for your entire career. Oily vehicles and nasal drops are a huge no-no. They're actually dangerous. They can paralyze the tiny little hairs in your nose called cilia that are meant to clear mucus. And even worse, if used over time, those oil droplets can get inhaled into the lungs and cause a really nasty condition called lipoid pneumonia. So for nasal drops, it is always a water-based or aqueous vehicle, period.
And because the nose is so sensitive, we have to be really careful with the formulation. It needs to be isotonic, which is just a fancy way of saying it has the same salt concentration as your body's fluids, so it doesn't sting. It also needs a neutral pH, around 6.5, to prevent irritation. Sometimes we'll even make it a little thicker, a little more viscous, so it hangs around in the nose a bit longer and has more time to work.
A perfect example of this in action is ephedrine nasal drops. This is a common decongestant that you'll absolutely see in a community pharmacy setting.
Now check out these ingredients. See how it all connects back to what we just talked about? You've got the drug, ephedrine. You have sodium chloride. Why? To make it isotonic. And what's the vehicle? Purified water, our safe, aqueous base. It's a fantastic example of how we design a formula to be both effective and safe for the patient.
All right, on to our final category for today, enemas, which are liquids given rectally. It's really important to understand that these can be used for a local effect, meaning they work right there in the bowel, or for a systemic effect, where the drug gets absorbed into the bloodstream to work throughout the body.
The definition itself is pretty simple, but the big idea you need to grasp is that enemas really fall into two very different groups, and what separates them is their purpose, which directly impacts their volume. This table just lays it all out so clearly. On one hand, you have evacuant enemas. Look at that volume, up to 2 liters. They are large because their only job is to flush out the bowel. That's it. On the complete other end of the spectrum, you have retention enemas. They're small, less than 100 ml, because they're meant to be kept inside the body so a drug can be delivered and absorbed. Totally different functions.
Okay, so let's zoom out and pull all of this together. What's the big picture?
What are the absolute core principles you need to take away from this explainer and carry with you into your practice? This right here is the heart of it all. The formulation strategy is completely dictated by the body part you're treating. The ear is fatty, so you need an oily vehicle. The nose is delicate and has cilia, so it has to be a gentle aqueous vehicle. And for enemas, the entire formulation hinges on whether you want to clean the bowel out or deliver a medicine.
And here it is, the most important point of the whole day. Getting this stuff right, choosing the correct vehicle, making sure the pH is right, it's not just some academic test question. It has huge, real-world consequences for your patients. Making a mistake, like using an oily base for a nasal drop, can cause actual harm. Your knowledge is what keeps patients safe and makes sure their medicine can actually work.
So I'm going to leave you with a little thought experiment to chew on. Think about everything we've discussed today: patient comfort, absorption, choosing the right vehicle. Now, how would those same principles apply to formulating something like an eye drop? The eye is another incredibly sensitive area, right? It's a great way to start connecting these ideas to other parts of your pharmaceutics course.